One go. We are going to talk about Danta Sarir. Means we are going to talk about these, which is new topic, which is included in new syllabus by NCSM for first year BMS. Kees Nakhen Danta Sarir. So today we are going to talk about Danta Sarir, and in coming videos we are going to also talk about Kees and Nak Sarir also separately. So what is Danta Sarir, or what are the things which we are going to get from our classical literature? Today, we are not going to talk about modern terms related to teeth and tooth and all this. We will only talk about the classical terms. So, first of all, we have to know about the Nirukti of Danta. So, as per Sabdos Mahamanidi and Williams, the word Dant is derived from the root Dama, which, when suffixed with Tana, gives rise to the word Danta, which means tooth-like, tusk-like, or two long sharp upper teeth in snake, so fang-like also, and literally meaning is continuous or spread up. So Kashyap Samhita has devised a complete description of Danta Sarir. This is the only text we are going to get the complete chapter on the Danta called as Danta Janmika Adhyay, because basically they are dealing with pediatric age. Because teeth are not grown fully at the birth, Ayurveda refers them as Jatasya Uttarajikala, means which we are going to develop after the birth only. Then we are going to talk about some references which we are going to get regarding to teeth, that is Dant in various Samhita. Like first we are going to talk about Charak Samhita. Dant and Dant Lukhal. There are two terms used which are considered to be the Asthi, and their number is given as 32. Dant Vestaka, chewing gums, is considered as one of the Pratyanga. Pratyanga are the accessory part of the body, other than six basic part, that is Sadanga. Dant is considered as the Pitraj Bhava, originating from Prithvi Mahabhuta dominance. While explaining the Asti Sara Lakshana, Sthuli Danta was mentioned among the Lakshana. In Sukrasala Lakshana, the features of Danta were given as Snigdha, Vrudha, Sar, Samhat, and Sikhara. Explaining Dirgha Ayu Lakshana, the Danta should be Sunivishta, means well ordered. While explaining the Vat Prakriti Lakshana, Danta Lakshana is said to be the Parusa, means Kathor, Ruksha. The abnormalities of Dant are narrated because of Vriddhi and Chhay of Asti. So basically, these Samhita consider as the Dant as the type of Asti only, or Ruchak Asti, jo specifically Susrut has talked about it. And the diseases which they occur, they are also considered in Charak, especially in Asti Pratosas Vikara. So these are some references which we get according to Charak Samhita about the Dant. Then in Susrut Samhita, again, it is considered to be a type of Asti. Number is 32, and that particular type of Asti is called as Ruchak Asti. Ruchak means one which gives taste. So after when the food is chewed, it mixed with saliva, and then the tongue is going to identify the taste. That's why it is called as Ruchak Asti. According to Sandhi, it will be a type of Ulukhala Sandhi, like pagan socket joint, talked in the modern terms. Praman of Dant is 2 angula. Dant is considered again to be the Pitraj Bhav. All the hard things which are coming from hereditary to us is from the Pitraj Bhav only. While explaining Dirgha Lakshan, Mahan Dasana, big teeth is the one of the Lakshan. Dhrudadhan is the Lakshan which is mentioned for the Asti Sara Purusa. Lakshan like Snigdha, Samhat, and Sweta are narrated for Sukra Sar Lakshana. Explaining about Vat Prakriti, he said that the person grinds his teeth in his sleep. तो रात में जो सोते समय दांत चलाते रहते हैं, दांत का आवाज करते रहते हैं, that is particular for the Vata Prakriti. A detailed account of disease is given here in, because Dant is a part of Mukha, so when they are talking about Mukha diseases, then they are talking about Dant and Dant Mool gut diseases. Two categories of teeth disorders are there. Ashtang Sangrah Samhita again says this is a part of Asti, and this are Ruchak Asti only. Sandhi is also Ullukhala Sandhi. Again, Pitraj Bhav, Parthiv Mahabhuta is इसमें. While explaining Isat Sarir Lakshana, several Lakshana of Dant such as Sukla, Sukshma, Snigdha, Ghana, Sama, and Gud Dant are narrated. While explaining the Vata Prakriti, again, the Lakshana is Tanu, Ruksha, and Alpa. Causing of teeth and tooth development is specifically explained in Ashtanga Sangrah. There are some description of rituals and sacrifices which are followed if the child is born with teeth. That is, we are going to talk after also. That is Sadant Garbha. We find detailed explanation about Dant and Dant Moolagat, Rog and Chikitsa in this particular Samhita. And the reference of Dant Lekhana Shastra is scratching, means जो तारतर या प्लेक लग जाता है teeth के ऊपर, that particular how to remove it, the Lekhan Sanskar or Lekhan Karma is described here also. Now coming to the Kashyap Samhita, where the maximum literature is given. So he also says Dant and Dant Lukla 32 in, and they are included in Asti. Dant Vesta and Dant Lohadi Mool are considered to be the Pratyanga. Achar mentioned Danto Utpatti, organogenesis of teeth, types of Utpatti, Dant Sampat Lakshana, what are the characters of good teeth, and causes of early and late eruptions of the teeth. Great importance is given to the Dantotpatti, especially and related diseases. Kashyap had described many stages of tooth formation like Sukshma, Murti Bhava, Udbhava, Patana, and Punarudbha and Sthiti. So these are some part of the development of the teeth. The period of teething is also described along with the teeth diseases before and treatment also. The period of teeth has been given here. We will see afterwards. A description regarding unfavorable teeth is also. So we can see many new topic, new consideration related to teeth is given in this particular Samhita, which we can consider now also as a clinical or functional anatomy of teeth. Then some more references we are going to get from Ashtanga Hridaya. So while explaining the Dirghayu Lakshana, Lakshana is said to be Ghana, Snigdhas, Lakshana, Seet and Sama. Detailed explanation of Dant and Dant Mulgat Rog is given. Sarandhar is given a new thing that Dant is a Updhatu of Asti and Mal of Medha Dhatu. 10 disease of Dant and 13 disease of Dant Mulgat is described in Sarandhar Samhita. Bhel Samhita again says these are the part of Asti only. Two Danta Vesta are considered to be the Pratyanga of the body. And when they are talking about Kapha Prakriti Lakshana, then the person should have the well arranged teeth. These are some references which we are getting from the Samhita. Next, we will talk about Dant Utpatti. The appearance of Dant or jaggedness in the oral cavity is called as Dantotpatti. Teeth development, dental disease, and tooth health are influenced by the various factors, is including jati, race, matraj, and pitraj bhav. That is that sadbhav में जो दो भाव आते हैं, that is considered maternal and paternal factor, and swakarma विशेष. Swakarma विशेष here just written socioeconomic status, but it can be said the habits, whether the person is doing teething, whether the mouth oral cavity is clean or oral hygiene is maintained or not. All these swakarma विशेष. According to Ayurveda, teeth are inseminated in humans from the 4th month. This is very important, from 4th month. Tooth development begins during the fetal life. The sonit that emerges in the gum pits eventually develops into the tooth. So there is a रक्त है जिसकी वजह से tooth बनेगा. And दंत भेद is the process by which teeth enters the mouth and becomes visible. So starting is from intrauterine life itself, but दिखाई देना शुरू होता है after birth. So birth with teeth, first eruption of upper teeth, eruption of scattered teeth, presence of fewer teeth and cracked teeth are considered to be inauspicious in Ayurveda. According to Ayurveda, there are 32 teeth in the humans, as shown in modern also. 8 of them erupt only once and become the tooth set in the original, which means those who are going to erupt twice. But Ayurveda also gives some rules for eruption. The first rule signifies that the teeth erupt in the same month they appear, which means if दंत appears in the 4th month of child life, they will erupt in 4 days. तो ये किस मंथ में इरप्ट हुआ और कितने दिन में वो निकलेगा, इसका एक यहाँ पे रूल बताया गया है. सेकंड रूल इज दैट it will take same number of year to replace the teeth that erupt in the same month by the permanent set of the teeth. So यहाँ पे क्या है, like somebody is getting first teeth in the 7th month, then it will be replaced in the 7th year. This is said by. Then again some things are there, like male teeth are harder, having harder gums. Then whenever there is eruption in male kids, there will be more pain will be there. So these are some set of rules which are given by the Ayurveda Classics. Teeth that sprout within the 8th month of child life are said to be the Danta Sampat. That is perfectly healthy teeth should be in the 8th month. If teeth appear before the 8th, they will experience some problem like Dorbal, weakness, then illness. Weber means discoloration, yellowish of the teeth, and Gunadanta means Krimidan means the caries or the germs will be there in the dental caries. Asthi and Majja are responsible for the formation of teeth. Along with these two, Rakt is also a sector in the Ayurveda. Falling out and reappearing of teeth mainly depends on the condition of Asthi and Majja, as they are said to be the basic factors responsible for Dantotpatti. So these Asthi and Majja is the most basic factor. तो अगर इस धातु में कोई कमी होगा तो teeth will be also not in the proper manner. Then Kashyap has also given a very scientific sequence of teething. Like number 1, you can see Nisek means insemination, which occurs from starting from 4th to 6th month of intrauterine life. Then Murti, that is structural changes. calcification and mineralization will happen again in intrauterine life. Then Udbhit, that first teething after the birth. Then Purvarupa, various symptoms that occurs before teething, like a child will be very much disturbed, he will be very much crying, or there will be some diarrhea type of symptom, बच्चा बहुत ज्यादा काटने लगता है, तो all this will be the पूर्व उपद्रव complication means occurs at the time of teething. They are related with the shape of teeth, various disorder occurring during the teething, what I have told you before also. Prasast, correct, prasast, improper teething, they include various signs and symptoms indicating the future outcome of the dentination. And upakarma of complication, that is treatment procedure, when if something happens, so what should be done. So these will be some part which I already described. Then we come to the types of teeth. So basically there are four types of teeth according to function and shape. First one is Rajdanta, top and lower front four teeth, which cut the food with their keen edge are sacrosanct, and their fracture disqualifies one from paying tribute to the Purvaja or the elders while doing the fire. So Rajdanta, then is a Vasta. Vasta is the corner one of the mouth and have one cups of pointed edge and are particularly strong and stable teeth, which are utilized for holding or grasping of the teeth. Then is Danstra, behind the Vasta. It's dancers which are designed to keep the food like canines, but also can crush it also. तो ये काटने और फाड़ने के काम आएगा. Then a Hanavya are the back side teeth, that's premolar or molar, which are basically for chewing purpose. So you can see some modern terms here correlated, and one picture is also shown. You can see the middle one are Rajtanta, then Vasta, then Dust, and the last will be the Han. Han will be two types, premolar and molar types. Then when the teething is going to happen, then also Kashyap has given there can be a four type, like you can see Samudaka, that is joined with a socket like cup. These are types of teeth developed in the malnutrition state of child. These teeth can fall very often. Then Samvrita, these are inauspicious and remain dirty. Vivrita, excessive salivation will be there. There will be chances that dental diseases will occur too much here. And then the Sampat is the first one, that is. So first three you can see they are abnormal, and the last one is the normal teeth. Then with the time of eruption also some characters are given by Kashyap only. So you can see if the first teeth is given in the fourth month, then it will be decaying and soon affiliated with so many diseases. Fifth month, there will be trembling, morbid sensitivity and easily affected by various diseases. Sixth month, upside down, dirty, discolored, prone to tooth decay. Seventh month, two pocket divided, striped, broken, dry, irregular and protruding. Eighth month, again, it's the best quality, uniform, compactness, whiteness, fatness, smoothness. Whatever is the good quality, it will be in the eighth month. Then Danta as a Pratangi, the youth Ratnagar has mentioned seven Pratangi of Mukha. Among them, one of them is Danta also. There are some synonyms given like Dasana, Radana, Khadana, Duija. These are some synonyms. Panchabhautik Swarup, as already we talked, Danta is the Upadhatu, Vasti Dhatu. It is dominated by Prithvi and Vayu Mahabhut and contribute to the stout and rigidity. Now, what is Danta Sampat? What is ideal dentition? So there are some qualities again given by Kashyap. You can see Purnatva, complete number of set, Samatva, evenness, they should not be front and back, Ghanatva, compactness, Smith, Suklatva, spotless, Salakshanatva, smoothness, Nirmal, clean, Niramayata, disease free, little elevated and properly closed, Sama, Snigdha, Raktata means the roots, the gums are having redishness, Dhrana, Khana, and Sthir Mool are said to be some qualities of Danta. So these are some qualities which are specific for Danta Sampata. Now, what are abnormalities? We have talked about normal, we have talked about anatomical concept. Now, what is abnormal? So, abnormality can be in any type, which can be on the basis of size, shape, number, color, placement, quality. You can see if the number of teeth, then there can be absence of teeth, that is danta abhav, heen danta, that is less number of teeth, adhik dant, that is more number of teeth. Size of teeth, it's very big, that is visal danta, macrodontia, rusva danta means microdontia. Quality of teeth, bhangur dant, that is fragile teeth, they are very weak. Placement of teeth, virala teeth, that is space is too much in between two teeth. Karala danta, that is irregular teeth. And vardhana ati danta, that is supranuclear, more than 32 teeth if they are. According to color also, it can be Vivanadan, that is discolored, Syavadan, that is black teeth. Traumatic teeth can be Danta due to some any trauma or accident. The fracture of teeth will be there, and due to dislocation of mandible also it can be Hanumoksha. So these are some Danta Vikriti which are very can say normal, especially in childbirth. Then what will be some Swarup? We are going to discuss one or two. Like Sadanta Janma. We have already talked if some child is born with the teeth, it is regarded inauspicious and it's supposed to bring danger to the household. This is old thing, what we have just mentioned because it is written there. Janma Purva Mritudanta. In newborn, the emergence of teeth other than those of Rajdant is considered to be inauspicious. तो अगर राजदंत के अलावा पहले कोई और तीत निकल रहा है देन अगेन द मिसफॉर्चून विरल दंत अगेन इट इज फॉर द स्पेसिंग इफ देयर आर टू मच स्पेस तो देयर विल बी सम प्रॉब्लम so this type of people don't have all 32 teeth. Then Akaladanta only Sarankar has given listed Akaladanta as one of the disease. The teeth may cut soon or too late. The child develops first, second, third month in the teeth, and again the problem is there some. Now some diseases name which are given by Susruti specifically to Dant Vyadhi, you can see Sitat, Dant Puput, Dant Veshtak, Sausire, Mahasosire, Paridhara, Upus, Dant Vedari, Vardhana, Adhimansa, and Dandanadi. You are going to learn these diseases in detail when you are going to talk about a Salaki Tantra. There they are going to teach you again these diseases. And then there are some Danta Roga. So you can see that Chikitsa Sthan in like Dalana Krimidanta, दंत हर्ष भंजनक दंत सकरा दंत कपालिका so there are certain number of दंत मूलकर disease as well as दंत रोग disease which are described in निदान स्थानों मुख सुश्रुत शरीर सुश्रुत संहिता. Now what are some rules about the dant swasthya dant hygiene? Again this is a part of Sastavritta. So those when you are going to go in the second year then this is in detail but here just that dant dhavan is some teeth cleaning which is described in Ayurveda. So it is why the Ayurveda says it should with some tweaks of the plants, especially, and as per their rasa, they are given the specific one also like Nimba for Tikta rasa, Khadira for Kasaya rasa, Madhuka for Madhura rasa, and Karang among the cutters. So these are the best ones which are described here. As everybody knows, if you properly do the oral hygiene, so it prevents decay, bad smell, gum bleeding, and our classicals have also mentioned some dant powders also. So for dant dhavan, especially with the ras of katu, tikta, kasai, ras darve, and therefore property of quick absorption of buccal mucosa and have cleaning property. That is, those tumhare lekhana. So they are going to clean your dant also. Many more things are given which will be taught to you in the Swasthvrita part. This here is just a glimpse what we have to talk. So all this was related to Danta Sharir. Hope it will be benefited for you. Thank you.